Those morning eye bags you thought were just age, sometimes they're your kidneys crying for help. Your face may reveal kidney disease years before any lab test does. Puffy eyes, yellow-gray skin, dry patches that won't heal. These aren't just cosmetic. They're silent signals most people miss. Stay with me, because I'll show you 5 hidden warnings your face may already be giving you, and what you can do about them. Many seniors believe kidney problems only show up in urine changes or back pain. But new research reveals your face may whisper the truth years earlier, long before complications ever appear. And here's why this matters. Catching those signals early could mean more years of walking freely, gardening without fatigue, and staying strong for the people you love. Of course, this is for education only, not medical advice. But I'll share science-backed ways you can spot the signs and protect your kidney health starting today. 1. Periorbital puffiness, morning eye bags. Have you ever woken up, looked in the mirror, and wondered why your eyes seemed heavier than yesterday? For many seniors, that morning puffiness feels like just age. But here's the truth. When your kidneys begin to struggle, fluid that should be filtered out at night starts pooling under the skin. And because the tissue around your eyes is so thin and delicate, it shows up there first. Research in Stat Pearls 2021 confirms this. Periorbital edema, or swelling around the eyes, is one of the most common facial signs of kidney disease. Think of your kidneys like the filters in a coffee maker. When they're strong, water flows through smoothly. But when the filters clog, water backs up. Your face becomes the place where that backup is written. Frank, one of my patients at 72, used to joke that his eyes looked like little pillows every morning. He thought it was lack of sleep. But after routine testing, his doctor discovered early-stage kidney disease. Because it was caught before major damage, small changes in his diet and medication adjustments kept his kidneys stable, and his puffiness slowly faded. That's why I always encourage seniors to ask for a simple urine albumin and blood creatinine test once a year. Together, these can detect early kidney changes with about 95% accuracy. And here's a practical tip. Notice when the swelling is worst. If it's more pronounced in the morning and lingers throughout the day, that's worth mentioning to your healthcare team. Like a sponge that can't squeeze out water, your face may be holding the first warning of something deeper. But swelling isn't the only signal. Sometimes your skin itself starts speaking. 2. Skin changes, dryness, discoloration. Now, let's talk about something even more visible than puffiness, your skin. Many seniors assume dry, itchy, or discolored skin is just part of aging, but often it's your kidneys struggling to clear waste and protect your cells from damage. A study in the Indian Journal of Dermatology, 2019, looked at 100 dialysis patients. Nearly 80% reported extreme dryness, and over half had noticeable skin discoloration. Why? Because when kidneys weaken, your body's natural antioxidant firefighters start running out. Free radicals, those sparks of cellular stress, build up and leave marks right where everyone can see them, your face. Think of it like rust on an old piece of metal. When the protective coating wears away, the surface changes color and texture. That's exactly what oxidative stress does to the skin in kidney disease. The yellowish-gray cast, the dullness, the rough texture, they're not cosmetic annoyances, they're warning lights. Margaret, 68, thought her dry patches and new age spots were nothing unusual. But after her doctor ordered a kidney function test, she learned her filtration rate had quietly dropped below 60. Once she started hydration therapy and switched to lanolin-based moisturizers twice a day, not only did her skin improve, but she also slowed the progression of her kidney decline. Here's a simple action. Apply a thick, fragrance-free moisturizer morning and night. Lanolin-based creams, in particular, have been shown to reduce itching and dryness by 50 to 70% within 4 to 8 weeks. And don't underestimate hydration. Seniors with kidney concerns often restrict fluids too much. With your doctor's guidance, balance hydration instead of avoiding it. But dryness isn't the whole story. Your stress hormones may also be involved. 3. Cortisol rhythm disruption, puffy cheeks. Now, here's something most people never connect to their kidneys: hormones. Specifically, your stress hormone, cortisol. In healthy adults, cortisol follows a rhythm. It's highest in the morning, then gradually declines as the day goes on. But in seniors with kidney disease, research in the Steroids Journal 2020 shows that this rhythm becomes blunted. Cortisol stays high longer, almost like a floodlight that never turns off. Why does that matter? Because cortisol directly affects mineral balance and fluid retention. When it lingers, your body holds on to more water. Instead of puffiness fading after you're up and moving, swelling in the cheeks and face can persist all day. Rosa, 70, used to laugh it off when friends told her she looked puffy. She thought it was just weight gain, but her doctor explained that her cortisol half-life was extended, meaning her stress hormone was sticking around far longer than it should. Once she started prioritizing consistent 7 to 8 hours of sleep and added light morning walks, her puffiness began to ease. More importantly, her kidney function stabilized. Think of cortisol as the body's traffic officer. Normally, it signals when to let water move along and when to hold back. But when the officer never steps aside, the intersection clogs. Your face is one of the first places this hormonal jam shows up. Here's a practical step. Keep a consistent bedtime and wake time, even on weekends, and try a 15-minute walk outdoors within an hour of waking. Morning light helps reset your body's cortisol rhythm, giving your kidneys and your face a much-needed rest. And when hormones stay out of sync, toxins begin leaving their mark on your skin color. 4. Facial discoloration, gray-yellow tint. Have you noticed your skin tone changing, looking duller, maybe even gray or yellow, no matter how much sleep you get? This is one of the most overlooked signs of kidney trouble. When your kidneys can't clear waste efficiently, tiny toxic particles called uremic toxins and compounds known as advanced glycation end products build up. A 2022 study in Frontiers in Medicine showed that seniors with declining kidney function had dramatically higher levels of these compounds in their skin. Instead of being flushed out, they accumulate and literally stain your tissues from the inside. Think of it like exhaust smoke staining the walls of a chimney. The smoke may be invisible in the air, but over time, the walls turn dark. In the same way, toxins leave a gray-yellow cast on your complexion. Helen, 74, thought her skin had simply lost its glow with age. But when her doctor checked her kidney filtration rate, her eGFR was already under 60, a silent stage of chronic kidney disease. By adding regular monitoring and switching to a more accurate Cystatin C blood test, important for seniors with lower muscle mass, she caught the decline early. With diet adjustments and medical support, she regained not only better kidney health, but also a healthier skin tone. Here's what you can do. If you notice unexplained changes in complexion, especially that yellow-gray tint, don't brush it off as just age. Ask your doctor about kidney screening. And if you have low muscle mass, specifically request a Cystatin C test. It often reveals kidney issues that standard tests miss. But the final sign may be the most hidden of all: a circulation shift that starves your skin of life itself. 5. Circulation and blood flow. Signs: ashen skin tone. Sometimes the face doesn't just swell or discolor. It can look ashen, almost drained of life. This isn't just looking tired. It can be a signal that blood flow itself is changing as the kidneys age. The Clinical Kidney Journal, 2021, reported that renal blood flow declines about 10% per decade after age 40, As filtration slows, blood is redistributed away from smaller vessels, including those that nourish your skin. The result? Less oxygen, less nutrient delivery, and a pale or dull complexion that makeup can't hide. Think of it like a traffic jam on a busy highway. When the main lanes clog, side roads receive fewer cars. Your face is that side road, starved of circulation, while the main traffic is stuck elsewhere. George, 76, used to describe his skin as colorless, as if all the vibrancy had drained away. He thought it was just part of aging, but his doctor explained that weak circulation was a side effect of kidney decline. George committed to walking 30 minutes a day, even if it was just around the block. Within a few months, not only had his stamina improved, but his complexion regained warmth. Small daily movement had reopened the traffic lanes. Here's a critical point for seniors. Avoid what doctors call the triple whammy, combining an NSAID pain reliever, an ACE inhibitor for blood pressure, and a diuretic. Together, they can quietly choke off blood flow to the kidneys, worsening circulation issues. Always ask your doctor to review your medications. Your face may be the first place circulation loss is written, but your whole body feels the cost. But what most people don't realize, these signs can appear years before traditional kidney tests show anything. Take a moment to think about this. Your face may whisper what your kidneys cannot yet shout. Those puffy eyes, dry patches, changes in skin tone, even that pale, washed-out look. They're not just cosmetic frustrations. They're gentle signals, often appearing years before pain or abnormal lab results. And here's the empowering part. Catching these signs early doesn't just protect your kidneys, it protects your independence. It means more years walking freely, gardening without fatigue, enjoying dinners with friends, or simply bending down to play with your grandchildren. So, tomorrow morning, when you look in the mirror, don't just check for wrinkles or gray hairs. Ask yourself, what is my body trying to tell me today? If this video opened your eyes, share it with a friend or family member. You might help them recognize a hidden warning they've overlooked for years. And if you're new here, I invite you to subscribe. This isn't just a channel. It's a community of seniors committed to aging with strength, clarity, and dignity. Every week, we explore science-backed ways to stay independent and live fully, even after 60. Remember, this video is for education, not medical advice. Always talk with your healthcare provider before making changes. Your kidneys are quiet workers, but your face can be their messenger. The sooner we listen, the longer we can thrive.